I'd like to actually bring out one case, which is, I find it very amazing for me because this case actually came to see me um because somebody told that we are doing wound care here. And that was the initial time when I received this spray, So I was very excited because this person, and this ulcer was a very chronic ulcer, which she has been having it for the last 6 years, and she has been going all around trying to, treat this ulcer. And it is a venous ulcer, actually caused by varicose problem she had. And so she came, there were two big ulcers, and then I explained to them that I'm going to try this, this is a new way of doing dressing. We will see. I cannot, I actually told her I cannot promise you, but because you have seen so many doctors, 6 years, I'm sure they would have tried everything. Let me give a shot. So I said every 2 weeks I wanted to see you. So they came from quite far. So they were coming after 2 weeks. As we went along, say about 2 months to 3 months, I could see the wound, the ulcer actually getting smaller, and I was very impressed by it. Both the ulcers were getting smaller for the first time, and the patients were really very excited. And so we continued for some time. It took us some time, at least about 6 months or so, and it became quite small. So I told them, okay, now it is getting better. So what you do is, I'll give you the spray, just continue, because they were coming from quite far, from another town, So it was very difficult for them to come. And I gave them the spray and they continued. If any problem, I told them to call me. If it is okay, then it's okay. So that was one case which I talk about, because there was really a good case where everything else failed, but this saved them.